Welcome to Type 1 Diabetic Warriors. Our team is committed to bringing Type 1 diabetics the latest medical developments to manage this disease. We also cover current medical advancements seeking a cure for T1D. If you value this content, please feel free to show your support by clicking on our homepage and hitting the link to buy us a coffee. Your support helps our team to research topics for upcoming videos. We thank you for your support.
Hey everybody, welcome back to Type 1 Diabetic Warriors. My name is Jim. Today, I think it is important that we talk about a subject that we don't cover enough on this channel, and it is one of the complications, a specific complication from T1D. When I first became a diabetic, I knew what the complications were. I knew enough about it because I had a cousin who was actually a nurse and a diabetic, a Type 1. She had been a Type 1 since she was 8 years old. I was 24 when I became a diabetic. And one thing I realized very quickly, I knew what all the complications would be, but I remember thinking to myself, once I got stabilized in the hospital, I feel pretty good. I knew I was going back to school, I had my life planned out for me, so generally I felt pretty good, but there was one thing that really burned into my memory, and that was the thought of amputation. That alone focused me on this lifelong battle of controlling my blood sugars. Today, we are going to talk about the American Diabetes Association and their guidelines for 2025 for taking care of your feet. Just think about losing a toe. That would be bad enough. What if you lost a foot or a leg? Let that sink in while we look at this video together. Please hit the like and subscribe button. It is very important that we grow and reach more people around the globe with this important information. So let's find out what the ADA says about diabetes, blood sugar control, and amputation.
Save your feet from disaster. The American Diabetes Association ADA 2025 Standards of Care in Diabetes includes detailed guidance on preventing foot complications for people with type 1 diabetes, T1D, and other forms of diabetes. Here's a summary of their key foot care recommendations to help you save your feet. 1. Annual comprehensive foot exam at minimum. Who needs it? All people with diabetes. When? At least once a year, or more frequently if there is, loss of protective sensation, LS, foot deformities, history of foot ulcers or amputation, peripheral arterial disease, PA. The exam should include skin inspection for ulcers, infections, calluses, assessment of foot pulses circulation, testing for neuropathy, monofilament test, vibration using a tuning fork, pinprick, and temperature perception. 2. Daily foot self-care for all patients. The ADA emphasizes the importance of patient involvement in daily care. Inspect feet daily. Use a mirror if needed. Wash feet daily. Dry thoroughly, especially between toes. Apply moisturizer to dry skin, but not between toes. Avoid walking barefoot, even at home. Wear well-fitting shoes and clean, dry socks. Trim toenails carefully. Main causes of foot damage in people with T1D. 1. Peripheral neuropathy, nerve damage. Most common cause of diabetic foot problems. High blood sugar over time damages nerves, especially in the legs and feet, leads to loss of sensation, so cuts, blisters, pressure points, or burns go unnoticed. Injuries aren't treated early and can worsen. Symptoms, when present, numbness or tingling, burning pain or sensitivity. 2. Peripheral arterial disease, PAT. Diabetes damages blood vessels, especially small arteries in the legs and feet. Poor circulation means less oxygen and nutrients reach tissues, slower wound healing, higher risk of infection and tissue death, gangrene. 3. Foot deformities. Neuropathy can cause muscle imbalances in the feet. 4. Infection. Reduced sensation, unnoticed cuts or blisters. Poor circulation, weakened immune response. Infections can spread rapidly and lead to osteomyelitis, bone infection, or even amputation. 5. Delayed wound healing. Chronic high glucose impairs white blood cell function, less effective infection control. Collagen formation, slower wound closure. Even small wounds can become chronic and infected. What is the percentage of diabetics facing foot amputation? General statistics on diabetic foot amputations. Lifetime risk. Up to 15–25% of people with diabetes will develop a foot ulcer in their lifetime. Of those who develop a foot ulcer, up to 20% may eventually require an amputation. That's roughly 2 to 5 out of every 1,000 diabetics per year. For these high-risk individuals, amputation rates can rise to 5 to 10% or more over a few years if ulcers recur or become infected. Good news, amputation rates are falling, slowly. Amputation rates have declined by 40 to 50% in high-income countries over the last 2 decades, but they remain much higher than in the non-diabetic population. About 60% of them are in people with diabetes. This is pretty scary, Jim. Have you suffered from this problem?
Well, thankfully, no. I have had absolutely no problems with amputation of any kind. I do know people who have had those problems, and it's a very, very sad thing. Because I've had other complications, but you got to remember, I've had diabetes for 42 years, and I've taken generally good care, very good care of myself. So if that doesn't scare you guys, and I'm always very eager to hear what you have to say, if that doesn't drill home in your mind the importance of blood glucose control, controlling those blood sugars at any cost, I don't know what's going to get that point across. I tell you, it still haunts me when I think about it, the idea of losing a foot. I mean, gosh, like I said, I had a kidney transplant 3 years ago, and honest to God, I don't think that was as big a deal as if my doctor said you've got gangrene, you're going to lose part of your leg. I don't know how I would react, but I do know how to avoid that at all costs, and that is to keep those blood sugars under control. So I'm praying for every one of you that you will keep your blood sugars under control and talk to your doctor on a regular basis. Thanks for hanging out. Thanks for listening. And again, always very interested to hear your comments. Hit the like and subscribe. As always, tell your friends about our channel. Even if they're not diabetic, they may know somebody who is. We'll have another very exciting video for you here in just a few days. We're working on some very interesting topics for you, and I can't wait to share them for you. Until then, have a great day, and we'll talk soon. Bye.